Thank you for calling University of Utah Health. My name is Cedrice. Can I get your name, please?
Care navigation is the front door for our patients and often the first point of contact when seeking care with University of Utah Health. Our role in care navigation is to provide compassionate and timely care by guiding, educating, and directing our patients to the appropriate levels of care. Our staff in care navigation are comprised of non-clinical advocates, medical assistants, registered nurses, and more ready to meet our patients' needs.
Well, I'm not sure if I need to get tested for COVID or not.
Okay, that's totally understandable.
I'm sorry you're not feeling well today. I think based off of your symptoms that you're having, we would want you to come and be tested for COVID.
Calls like this are all too familiar in the Care Navigation Center now. Before March, we'd never been in a pandemic. Suddenly, Care Navigation was receiving an unprecedented surge in our patient call volumes. Seemingly overnight, our organization's call volume increased by over 45%. And these weren't just COVID-related calls. These were related to regular scheduling calls, rescheduling calls because of the pandemic, and the pandemic hotline alone.
I'm a trainer, and so in my training classes, we instantly had to shift gears on how we were teaching and what we were teaching and put people on the phones to fill the volume of calls that were coming in.
From the beginning, it was pretty evident that due to the pandemic, we couldn't continue to operate as normal. We needed to make some changes. To use an example, if you're on an airplane, when those masks fall down, after your initial what's going on, they always tell you, put that mask on. Make sure you're safe and healthy, so you can help the people to your right and your left. To paraphrase Dr. Good, if Care Navigation gets a cough, the organization gets pneumonia. And leadership didn't want us to get that cough, wanted us to be safe, but also wanted us to be ready and available to support our patients and our community, where we really are the front door to so many parts of the organization. The first way that this really was demonstrated was the enormous push, both with the focus of leadership and so much help from IT, to really just empty this building to get so many people home so they could work from the safety of their own homes. With it being a call center environment, we couldn't keep operating with everyone here. For perspective, prior to the pandemic, it might take a few weeks to get a few agents home, but somehow, through efforts of many people, we were able to get over 200 employees home in just a 10-day period. It's been just a tremendous benefit to be part of a team where we know we can depend on each other throughout this whole process.
I want my patients to get the best possible care they can get in the clinic, but all throughout their care experience. And that's where our Care Navigation team comes in. They do such a great job taking care of our patients from their first contact with us all the way through their care experience. They're really an integral part of our care team.
Care Navigation is the heartbeat of the organization. We were the first to find out a lot of intimate situations within our community, whether it being the NBA shutting down, a certain city being closed. And it was tough to be able to know those intimate situations. However, we had a job to do for the community and our patients.
We did not do this alone. We trained over 150 care team members that included non-clinical all the way up to our advanced practice clinicians.
The reason why I'm so honored to work for this organization is because of the support that our executive leadership gives to our entire organization, and it just trickles down through everyone. And I felt that and saw that. And with that, we were able to build these policies that were ever changing. We were able to have a newfound confidence that we could share with our team to keep them steady.
It was a huge undertaking for our training team as well as our workforce team to get these volunteers trained and into our department, which we are grateful for that. I was so impressed to see the amount of work that everyone put in as a collaboration to make this come together.
People sometimes say, hey, it's just a call center, but it is not just a call center. We help our patients here, and we pride ourselves in providing our patients with the best care possible.
I absolutely love working here at Care Navigation and how we're able to help our patients.
Muchas veces cuando los pacientes hablan y saben que tienen que hablar en inglés, se sienten muy nerviosos. Pero cuando escuchan a alguien del otro lado de la línea que los ayuda en su propio idioma, se sienten más relajados y más cómodos. Me da mucha satisfacción saber que yo puedo ayudar a nuestra comunidad hispana en ese aspecto.
I love my job. It's a totally different avenue from bedside nursing to talking to the patients on the phone, but it's actually an amazing opportunity to be able to help the patients before they even get to the clinic or wherever they need to go.
We are glued together. We support each other. We love each other. We are a working family. Together, we are a wealth of knowledge. We are Care Navigation.